Hey, how's it going, everybody? Welcome back. I'm Mr. Milanese, and today's exploratory activity is all about nursing. So nursing, of course, is a class that's intended for people who want to do something in the medical field after high school. And whether that's to become a nurse, or you want to be a doctor, or even like an anesthesiologist or a pharmacist, nursing is probably the class for you because you're going to get all of that medical background that you need while you're here in high school. Along the way, you're going to have the opportunity to earn a Cna Certification. So this is for some people who want to maybe just work straight out of high school. And with that Cna certification that, by the way, you can get for free while you're here, you can go work in a hospital setting, making really good money and have great benefits and all that straight out of high school. If, however, you want to move on and get some sort of like a 4-year degree or beyond, this nursing class is going to give you up to 12 hours of college credit that you can earn for free while you're here in high school. As if all of that weren't good enough, for taking the nursing class, in addition to getting that nursing credit, you're also going to pick up a science credit and a senior English credit. So your senior year, you're not going to have to worry about taking science or English because you've sort of bundled it with the nursing credit. So there's a lot of benefits. If you are considering something in the medical field, we highly recommend you take a look at nursing. So with that in mind, go ahead and get out your box labeled nursing, open it up, and let's get started.
Hi guys, my name is Mrs. Kessler, and like Mr. Milanese said, I'm the nursing teacher here at the Career Center. Today we're going to do a little demo on how to obtain a pulse count, both by feeling it and by listening to it. Vital signs is one of the most important things that you're going to learn about if you do come and attend the nursing class with us, because vital signs are often the first indication that someone is sick or not feeling good. So the 4 main vital signs, the first one is temperature, and I think everybody's really familiar with how to obtain your temperature, especially in the times that we're in right now. Respirations is another one, the number of times somebody breathes in 1 minute. Also very easy because you can watch people take a breath in and let that breath back out. Blood pressure is the third vital sign, listening to how hard the heart is working to push blood through the body, and that's something that requires a little bit more hands-on, a little bit more detailed that you'll learn if you come to attend the nursing class here with me. So today we're going to talk about pulse. That's the 4th one. Pulse is simply the number of beats your heart performs in a 1 minute span of time. There's 2 different ways you can obtain pulse. The first one is by feeling, and the most common place to feel your pulse is in the brachial artery in the wrist on your hand. You use 2 fingers and you can put it right there just straight down from your thumb, and you'll feel your pulse beat. Your heartbeat is literally what your pulse is, and you'll count that for 1 minute. Today though, we're gonna do listening for your pulse, and that's gonna actually be over your heart. So I'm gonna use this mannequin here that we use in the classroom in our nursing studies a lot, kind of for my demo. When you're doing this at home, you're gonna wanna get somebody to help you, a parent, a sibling. You can listen to your own pulse. It's a little bit awkward though, so get somebody to help you while you're practicing and learning how to do this. So in your box that's marked nursing, you'll find something that looks similar to this. The boxes are a little bit different. We had a couple different varieties of stethoscopes, but they all work the same way. So get your stethoscope out. You're gonna need that for this demonstration. The stethoscope, very self-explanatory. This end goes in your ears, this end goes on your patient or the person that you're working with if you're at home, you know, working with mom or dad or a sibling. You want to put these pieces in your ears, and you want the tips of the stethoscope to kind of point a little bit forward. It goes into your ear canal a little bit better, and you can hear a little bit better that way. This is called the bell of the stethoscope, and you always want to use the bigger end on an adult. This end will just lay right on the patient's chest. Be careful though, once you put these ends in your ears, if you knock this on something, it's going to be very deafening, so we don't want to do any damage to your ears, so be really careful with that. So the first step is to just put the stethoscope in your ears, use the bell of the stethoscope, and your heart is located, everybody thinks it's kind of over here on your left chest. It's really not. It's kind of a little bit more centrally located because of your lungs and the anatomy within your body. So you want to go kind of a little bit in towards the middle, and you'll just put the stethoscope on. Generally, you can find it on the first try. You may have to move it around just a little bit, but you can hear it kind of echo through the chest cavity, so you should be able to hear it very easily. So you want to put it on, and you want to just listen, and you'll count each beat, boom, boom, boom. You can hear the beat when you use it, and you'll count when you use the stethoscope, and you'll count for 1 minute. So after that 1 minute is up, you should have a number somewhere between 60 to 100 on a healthy average adult. Young adults, people that are healthy, that work out, that exercise, may have a little bit of a higher or a lower pulse rate, just kind of depending on what their activity level is. But 60 to 100 is pretty normal for a healthy adult. Kids are going to be higher. Their hearts are a little bit smaller. They work a little bit harder to circulate the blood through. So you're looking for about 60 to 100. Anything above that or below that, if it's significantly above it or below it, may indicate that there's some sort of blockage within the heart, or they may have just completed some kind of activity or have some kind of stress or something to the heart. So that's obtaining pulse count. The other thing you're going to find in your little box that's labeled nursing is a small Ziploc baggie. And within that small Ziploc baggie are some dried beans. When you come into my classroom for exploratory, or when you're with me for the nursing class, I have some simulators that replicate some different diseases like Parkinson's disease and arthritis. So in order for you to try this at home, we're going to take those beans that are in that baggie and just put them in your shoes. If you want to, don't want to wear shoes and you want to put them inside your socks, that's okay too. This will replicate what it feels like to have arthritis in your feet. And arthritis is just the swelling of joints, so that there's not as much cushioning and padding around your joints, and it can be anywhere in your body, but it's most simple to replicate it in your feet. So put those beans in your shoes or in your socks, and I challenge you to wear them for about a half an hour. Just kind of walk around, try some different surfaces, go up and down steps. Maybe if you have a gravel driveway, go out in the driveway and walk around and just kind of see what that feels like. We do that in exploratory and within our nursing class, just so you guys as students can kind of see what the patients feel like when we go to take care of them in clinicals at the nursing home. So try that. If you don't think that it hurts at all, it's not uncomfortable at all, wear them for a little longer. Kind of see how long you can wear them, see what it would feel like to have arthritis in your feet. Guys, I hope to see you sometime in my classroom or at the Career Center in another classroom, and I hope you have a great day.